Hello, my name is Scott McMullen, and I'll be the nurse today to our patient here of Beth Simmons, who is a 24-year-old that is postpartum of C-section delivery. Of course, this is our study scenario, and the first thing I would do coming into the room would be to check for two different identifications. So name, full name, date of birth, phone number, things like that can definitely kind of help us out to make sure that we have ID'd the right patient, and also scan the armband as well. Um, and before we, after that, what we would do is, of course, our hand hygiene to get ready, and then we'll put on our gloves as well to be safe. So, so as I'm putting on gloves, I definitely can ask some questions. So I know kind of the things you were hurting, pain. So you were still getting our morphine, and a pain is about a it's still about a 6 on the scale, and it hurts worse when she's ambulating, and of course she's coughing or doing those deep breathing exercises that you want to do about every every hour to help promote that not getting pneumonia. So some things that we could do before we take her thing is we could definitely educate when she's coughing, things like that. You could take a pillow and definitely bind it to kind of help support that, especially that incision that she has as well. So we'll first get our blood pressure and count respirations, and also take our temperature and see where kind of the baseline of her vital signs are. All right, so our vital signs are 120 over 82, which is fairly normal. Our respirations are at 102 breaths per minute, and our respirations are at 12. So she's breathing in normal. Her heart rate is 102, and which is a little above the kind of that tech, and she's in that tachycardia, which is definitely to be expected. Just had surgery 2 days ago, and a lot of pain. So, and of course that's our primary goal. And speaking on her aspect of her pain aspects is she's at a 6 out of 10. So still, it's not excruciating pain. It doesn't sound like, but it's still pain, which we definitely have to and look at as well. So another complaint that she is having is, of course, that she's having some gas pains, and then definitely uh, definitely hurts to go to the bathroom, but she has not kind of went to the restroom in a little bit as well. So what we're going to do first is we're going to oscillate our uh, our our abdomen, and of course we're going to start with our right upper quadrant. Make sure everything's okay. Since she is getting morphine and tramadol, and even Tylenol and things like that, those things can cause constipation. So we definitely want to make sure that everything is going okay as well. So we'll listen to it and see if everything's active as well. And we'll go through all four quadrants. Make sure everything is going okay. And then also what we would try to do is, of course, look at our incision and see if our incision is how it's looking. It's definitely going to be probably stitches that we have. So our suture line is going to be something that we try to see if it's red, it's warm, see how the incision is. Is it any kind of other drainage and just basically serous, and which could further up like infection and things like that as well. Since her temperature is at 100 and 1.4, it's possible that she is going through some infections as well. So that's some things to definitely watch out for. Definitely alert the physician to know that that temperature is up there. And of course, she's also been complaining of a red, kind of warm feeling, which could pass on her lower extremity, which could indicate that she has a deep vein thrombosis. So we definitely want to tell the doctor about that to see if they want to do a Doppler ultrasound to see if that's really what it is. And then they will actually start with some anticoagulant therapies as well to give that support, and also put on TED hose as well. So definitely those are some things to assess on this patient as well, and hopefully she'll get the feeling a little bit better as well. So thank you. This is my assessment. I hope she's doing well, and bye everybody.